with us. But here today we have Anthem, WellPoint's California subsidiary, in a dispute with the California Insurance Commissioner. The evidence shows that Anthem submitted, as required by California state requirements, their actuarial determinations as to why they needed to decrease premiums less than 20%, as well as raise some premiums as high as 39%. The evidence also shows that the California State Insurance Commissioner did nothing with the actuarial information they were given by Anthem. They did not raise a single complaint for over 4 months. Now, why the federal government is involved in a state issue, a state dispute, to me presupposes that the fundamental difference between the line of thinking between national Democrats and national Republicans in the health care debate. The central argument of the Democratic Party is that we need a national, single federal regulator oversee all health insurance companies, but Republicans believe fundamentally that insurance is a state issue and based on risk pools, how many people get sick at one time versus how many healthy people there are who won't get sick. So the actuaries look at the marketplace and determine this ratio. And of course, we're involved right now in this tremendous, tumultuous healthcare debate, or what used to be called a healthcare debate before the president renamed it health insurance reform. And that's why the timing of this hearing couldn't be more coincidental. And just for the record, I'd never attribute anything to coincidence if it can be adequately explained by conspiracy. Tomorrow, the president is holding a bipartisan photo op on health insurance reform at the White House, a 6-hour photo op, so it's a significant photo op. And his Secretary of Health and Human Services has used the state-based issue, the increase of Anthems in the state of California, to increase support as another reason why we need a $1 or $2 trillion health reform package. In fact, his Secretary of Health and Human Services has said that the profits of Anthem are outrageous, her words, and that the insurance companies should not make that much money. Why does profit matter if the actuaries have done their work? Well, I'll agree, a 39% premium is a huge number, a big scary number, but it may be irrelevant in this debate if the debate is on whether or not the business model of the insurance should be based on what the actuaries are determining as a risk spread. Now, I will make no apologies for the insurance companies. They're certainly capable of defending themselves, and if not, then they deserve what they get. But I think a GAO report needs to be commissioned to study how the insurance companies determine how much they are going to charge with their premiums. But if the numbers show that there will be a precipitous decline in the number of people who are in the risk pool, then any number, no matter how big, may in fact turn out to be acceptable. So if we're just focused on solving the dispute between California and Anthem, whose actuary is right? Now, wouldn't that be a scintillating hearing? We could have dueling actuaries. If Anthem is right, their actuary portrayed an accurate risk for the state of California, or is the California Department of Insurance right to complain 4 months after the fact that Anthem is a bad insurance company? But you know what? We're really not here to answer those questions. We're here to answer whether there needs to be reform in the healthcare industry as a whole. And I will tell you, as a practicing physician for over 25 years, there needs to be. Costs are a problem, yet after months and months of debate, we really haven't figured out how to answer the question, how do we bend the cost curve? Or actually, we figured out how to bend it in the wrong direction. We haven't determined whether these costs are conclusively attributable to the business practices of healthcare providers who are sometimes impugned, or the insurers who are often impugned, or whether these costs are attributable to what the First Lady is focusing on, lifestyle choices, diet, exercise, and the epidemic of obesity. Or maybe it's just because people are living longer and the costs of treating an older generation were never envisioned when we created Medicare back in the 60s. And of course, there's the advancing complexity of what we are able to do. The very fact that we have more than one cholesterol-lowering medication on the market is significant. What we can all agree on is there needs to be reforms in the health industry. Let's get rid of pre-existing conditions and lifetime caps. I'm for that. Let's work on tort reform. How about increased competition? I could be for that. Increased flexibility and portability? Who'd be against that? How about some improvements for people who are stuck in a COBRA system so that they're not stuck with such a high premium? I could be for that. But, you know, we're going to turn our attention to the President's Summit tomorrow. I hope the President is truly interested in including good ideas regardless from which side of the dais they emanate. I'll yield back the balance of my time.